Hi, today we're out at Lucybell Farm enjoying this nice day out in the nature and just enjoying the beautiful day. And today I'm here with Shali Reynolds. And Shali is actually a nurse practitioner. And you want to talk to us today, or I'm excited to have you talk to us today, about a new weight loss product that's out there. And I know for a lot of people right now, right before Christmas, right as we start the new year, we're looking at weight loss and whether we want to do it before Christmas or if we want to have it in our back pocket to do after the first of the year. Your product is really, it's making the news, and there are a lot of people that have been doing this. And can you just tell us a little bit about it?
Absolutely. So our company just launched a all-natural 10-day reset program. Actually, CNN just featured it recently. We just launched it July 10th, and it's already made headlines. We've already had more orders at the very beginning than we could process in a timely manner. We're now caught up on that, and they're shipping next day from the time that they're ordered. So basically what it is, and I'm glad you mentioned the whole New Year's resolution type thing. So that is people's number one typical New Year's resolution is to lose weight and to get healthier.
Right, that's fine.
And so, you know, we start January 1st, we do good, and by about February 1st, things don't start changing on the scale,
Right.
And so we kind of lose our interest in it sometimes. And so this is actually a nutritionally sound, all-natural 10-day reset program. It kind of comes in a box. It's whole food, raw foods. You basically do 3 different steps to it. You do a drink, you do something called a dough bite, and then you do a chocolate shake about 3 hours apart from each other, and then you do a sensible meal. And basically it's a ketogenic type lifestyle.
Okay, and what does that mean?
So basically ketosis or ketogenic diets have been around since the beginning of time. Actually, breastfed babies are still in ketosis. So what a lot of people don't understand is your body is meant to burn fat.
Right.
We have a video out called The Big Fat Lie because we've been kind of programmed to think that eating fat makes us fat. And it's actually carbohydrates and sugar that make us fat, that our body stores. Our body converts to sugar, even carbohydrates, and stores that in our liver, stores it as a long-chain glycogen, and helps store fat cells, specifically in the abdominal area. And so getting into a ketogenic type lifestyle actually allows your body to burn fat for fuel instead of carbohydrates and sugar. So we try to limit, we're actually detoxing your body from the carbohydrates and the sugar through that all-natural drink in order to convert you into a fat-burning body. And the bad part about having to do a ketogenic lifestyle in the first few days and to convert over is people have something that they typically call the keto flu. It's very hard to get over those sugar and carbohydrate cravings. So a lot of people quit at doing the ketosis. And so our product is designed to actually convert you into a state of ketosis after drinking the drink within about an hour or two instead of days or weeks like it used to take with you going through the standard diet.
And, you know, you talked about that you get to eat something too. I mean, this isn't just a starvation thing, because I know a lot of times, you know, in the past you go on something and they tell you just drink drinks all day long and you don't get to eat any food. And by day 3, you're like, I can't stand it anymore. I have to eat food. So you get to eat on this. Okay.
You get to eat on this. You get to eat high-fat foods. You're going to eat steak. You're going to eat pork chops. You're going to eat eggs. You're going to eat real bacon. You're going to eat, we even eat pork rinds with guacamole. Yeah, I mean, you know, we eat a lot of bacon and a lot of eggs. I mean, it's a high-fat diet. So yes, you're eating. You can eat with the dough bite. You can eat with the fixed shake. You're going to eat your meal at night. You're typically eating about every 3 to 4 hours on this plan.
And are people seeing results?
We're seeing great results. Due to corporate compliance issues, I'm not going to give out a standard number that people see just because everybody's different. But I can tell you we have a gentleman by the name of Andrew Moran out on the West Coast that's in our team of distributors who's lost 100 pounds.
Wow.
In 10 weeks using...
10 weeks?
10 weeks.
Wow. Okay, so that means if we started in January, by like the middle of March. Wow. It depends on obviously how much you have to.
He started in August. He started in August, and he did a couple of the reset plans. The beauty of this is designed to reset your lifestyle. It's not just a quick 10-day fix. It's basically depleting your body of the carbohydrates and sugar so you don't have those cravings anymore.
Right.
And you really don't. I stopped at a fast food place the other day traveling to get an unsweet tea, and they mistakenly gave me a sweet tea. So when I took a sip of it in the car, it actually almost kind of made me sick.
Right.
So how could I actually drink that before?
Right.
Yeah.
Well, I have to kind of do a disclaimer here. You know, my dad and I did this, and that's one of the reasons that I wanted y'all to come out and talk with us today. And I lost probably about 6 pounds, and my dad lost right at about 10 to 12 pounds. And I know I lost inches, and I know I was supposed to weigh, but I didn't. But my pants fit. You know, I did go down a size in my pants. But the reason that I'm telling you this is because because we were at the outlet mall the other day, and I asked my sister-in-law to go get me a water. Well, she came back and she had a drink for me, and she handed it to me, and I tasted it, and I said, "What is this?" And it was Diet Coke. And before I went on the program, I drank Diet Cokes 2 and 3 a day and loved them. And when I drank it about 2 weeks ago, it was awful. So I couldn't believe it. I couldn't believe it.
So your taste buds turn over very rapidly, and so you really do get to where you just don't enjoy the taste of those foods anymore. You know, you're gonna find times where you're at a party or you're out having a nice dinner and you want to have dessert. The beauty of this program, this reset program, is if you go and do that, if you go and have those foods, which is converting your body back to a sugar and carbohydrate burning body, you just simply drink the drink again the following morning and get back into a state of nutritional metabolic ketosis.
Right,
and like
right,
you said,
right.
this is not a starvation ketosis.
Right. I mean, we were
This
never
is not your body
hungry.
burning fat because you don't have anything to eat on.
Right,
your body's
right.
eating its fat for food, and actually fat provides your cells 200 to 300% more energy than glucose or carbohydrates can. And we were very energetic, almost euphoric energetic on the program. I lost 7 pounds in the 10-day reset, and then remained eating ketogenic foods for 3 to 4 days after that.
Right.
Lost an additional 3 pounds. And so we've done that one plan. My husband lost 15 pounds on
Right.
it. So just a very flexible, easy to use, scientifically proven program.
Right. And I know there's other things that y'all offer as well. You know, my dad swears. I mean, my father, Eddie Dennis, swears by the pain patches.
Yes.
I mean, he buys them and passes them out to anyone. He keeps them in his car.
Absolutely.
And when someone says, "Oh, my back is hurting," I mean, my dad runs to his car and hands them a pain patch.
Absolutely.
I do not have back problems, so I cannot attest to that at all.
Okay.
But tell me about that, because my husband, who has had cancer, swears by. I mean, everybody my dad has ever given these to swears by these patches.
So the patch she's referring to is called a Power Strip. It was actually the first product that we got 22 months ago when we became a distributor, and the company was still in pre-launch. It's an all-natural, biodegradable patch, just a topical patch that you put on your skin. It's flesh-colored. It's actually listed with the FDA as a Class 1 medical device, and it's indicated by the FDA for the relief of pain and also for the look and feel of skin. It works by providing far infrared heat into the tissues.
Oh, okay.
So you'll hear of people going to chiropractic centers to get far infrared treatments, or some people with chronic pain buy far infrared saunas for their homes to get in those.
Right.
This is actually it's just you put it on your isolated spot, whether it's joint pain, whether it's back pain. People with migraines put them across their forehead.
Really?
Yes,
Wow.
it has all
See, I
types
didn't
of
know
indications
that.
for pain. But yes, they basically provide far infrared heat into the tissue, which activates nitric oxide pathways in the body, dilates blood vessels, and brings oxygen and blood flow to the site of pain. It's also got fermented Korean red ginseng, capsaicin, which is a derivative of chili pepper. Again, so all natural. You may feel a little heat from the patch. That's completely normal.
Right.
But even the adhesive on it's all natural, so no skin irritation issues with it.
Wow.
And they just flat out work. Some people get relief from them as little as 20 to 30 minutes, and sometimes hours or days, depending on the chronicity of the pain,
Right,
how long
right,
they've
right.
had it. So yeah.
And they last. I mean,
And they last.
Yeah. So there was something else too that I wanted to ask you about, and I know you all have how many products? A lot of different products.
We do. We have farmers market products that are organic and whole foods. We have LArginine supplements, which are pharmaceutical grade, which are Nobel Prize winning for cardiovascular health. That's
Okay.
our LArginine. So we have a lot of cardiovascular patients who are bodybuilders that like to be vascular.
Okay, that's what I
Yeah.
wanted to ask you about. Your husband was telling me there's a strip now that you can put in your mouth, and it dissolves, and it can release all the vitamins, and that is my next thing. I'm going to get that for myself, my husband, and my
Absolutely.
children.
And so I'm glad, this is my first time meeting Sarah, you guys, but I'm glad that you brought that up, because I completely agree. Every man, woman, and child on this planet needs this product. My daughter takes the product. My husband and I take the product. It is exactly what you said. It's a little breath strip that you place on your tongue, very similar to a Listerine breath strip. It's lemon flavored. You place it on your tongue. It's got over 50 elements, nutritional elements to it. It's 100% bioavailable, which means you put it on your tongue. It's absorbed through the buccal mucosa of your mouth. So like stroke patients in the hospital,
Right.
People that can't swallow, we give them medication in their cheeks. They absorb it very rapidly. It's very effective. And so you're getting over 5 pages of nutritional analysis. And
In this one little strip.
in the one little strip. And it's very dense microscopic algae is what it is. It's called marine phytoplankton. And it's actually the base of the food chain for ocean life. So if you take satellite images from space, all the glowing stuff in the water is
Right.
marine phytoplankton. So, a lot of us take synthetic vitamins and
Right.
supplements. And, I'm by no means a research specialist on vitamins or supplements, but most studies show that the synthetic vitamins that you swallow, you have about 4 hours from the time
Right.
for it to go through your GI system before it's passed.
Right.
So whatever you don't get out of it, you're not getting.
Right.
And most studies show you get about 8 to 15% of those actual synthetic supplements that you take. So my question to most people is, would you rather take something that God made and put it in your body to nourish your body, which is what, it's the base of the food chain for whales. They live to be about 150 or so years old, despite their size, but this is the base of their food chain.
Okay.
So basically getting all amino acids, phospholipids, electrolytes, vitamins, minerals, trace elements, essential trace elements that you need that we typically don't get from our standard American diet.
That's something that I'm definitely going to order, probably even today. Then, and I want to go back before we finish, because we only have a short amount of time. I want to go back to the ketosis,
Keytopia.
to Keytopia, because a lot of my friends have asked me when I've told them, and you're a nurse practitioner, so we're asking you as a nurse, is this okay for people who have diabetes?
Okay. Absolutely. So, disclosure statement, anybody that has any chronic medical conditions, diabetes, high blood pressure, heart disease, always consult your physician, obviously, if you have concerns over taking this. What I will tell you is it's a whole food product. It's all natural. There are no drugs in it. So, I tell some of my people that just have maybe a little touch of diabetes, they're on an oral hypoglycemic medication, they take glucophage or something, blood sugar's pretty stable. I say, well, typically you don't go ask your doctor if you can eat cauliflower.
Right.
So, it's always good to consult them before you use the product. But we have type 2 diabetics that are not insulin-dependent diabetics that do very well in this program. And quite frankly, and I do a lot of lectures about this in our community, the main reason that people are type 2 diabetics is because of their weight and their diet. So we've actually had some customers actually be able to reduce their diabetes medications or come off of them completely after the weight loss, because they carry a lot of storage of fat around the abdominal area, which makes them insulin resistant. And when they get rid of that, their cells aren't as resistant to the insulin, and so it's able to get taken up into the cells and reduce the glucose level by itself.
And you said high blood pressure. That was the other question that I had. Someone asked me, is this okay to take if I have high blood pressure?
Absolutely. Again, all natural. We encourage people to monitor their blood sugar, their blood pressure, thyroid disorders. If you have those, have your levels checked frequently while you're doing the program, because your levels will change, and you may need to reduce your medications while doing that. So yeah.
Okay. Well, great. Any last words you want to tell anyone?
I
It's
just
great.
wanna-
She is like living proof here. I mean, you are beautiful.
I'm on Facebook.
You are beautiful, beautiful. You
Thank
look
you.
great, and we're going to give you the Facebooks, the websites you can go to order all of this. And thank you so much. I mean, I'm excited about doing it again. And like I said, I did lose some weight. My dad lost some weight. We felt good. We were never hungry when we did it. And I'm looking forward, to doing it again, probably before Christmas, and then, trying at that point then to stay off of a lot of the sweets and the carbohydrates and that sort of thing. So, but I'm telling you, coming off of it, I did. I mean, I didn't crave,
Absolutely.
One thing I ask your husband too, and a lot of our viewers, you may or may not drink alcohol every now and then. And I said, can I drink wine? And he said, no, not while you're on the program. But, even after coming off of it, I mean, even like just that occasional glass of wine or, it was just like, I don't
even crave it as much.
I don't care. So he did tell me I could drink coffee. So I did drink a little bit of coffee, not a lot.
Sugar.
Yeah, I did drink a little bit of coffee while I was on the program, and continued to drink coffee. And that was really, and like I said, then my father and I, we looked forward to dinner every single night, and we had steak and broccoli and
butter.
It was great. So anyway, well, Shali, thank you so much for being with us today, and we just have had a great time, and we've learned a lot. And like I said, we're going to put up the websites, and if anyone has any questions, we'll give you information on how to get in touch with Shali. And I'm just excited about this. Thank you for sharing
Thanks
with
for
all of
having
us.
us out to your beautiful place.
Thanks.
Love it. Yeah. Thank you.